Sherry, hello.
Well, hello, Mr. Wild.
I want to introduce Sherry Picker of Paradise Home Healthcare. How you doing?
Good afternoon. I'm doing very well, thank you. And yourself?
Hanging in on a hangout.
Okay, there you go.
Hey, I want to ask you a few questions.
Sure. What's on your mind?
Well, as an expert in home healthcare and home care, I want to ask you, how do you know and when do you know that home and in-home care is needed for a person?
Well, people usually know in their gut when they need a little help, when something has changed. It can be obvious because they had an operation or in hospital or coming home from rehab and they're not allowed to drive or bend or lift. When it's not a physical problem, if it's more of like a cognitive or a dementia, people usually wait a much longer time. It doesn't click that there's changes and they need some help. Help is usually brought upon during a crisis in that case. So we recommend people to really kind of be honest with themselves and find out about help before they need it. Just like people have a roofer or a mechanic or an electrician they call on, we like to encourage people to start a relationship with a home care company before they actually need help. So if that emergency happens or they need to fly out of town, if someone's a primary caregiver to a spouse, they don't have to first start looking for a company and fill out the paperwork. They just make the call and say, hey, we need help today. We need help tomorrow at 10 in the morning, you know, send help.
Well, let me ask you this. How do you find a good company?
Well, a lot of people find us through our standing clients or previous clients. It's word of mouth. You can find out from your doctor. You can find out from a lot of different places, a senior center, a daycare center. Most people find help on Google or a different search. They find help on the computer because in South Florida, it's a little unique because a lot of times, most of the time, family, meaning the children, an adult son and adult daughter live out of state. So they're looking for help really online and then they zero in.
How do you know a good company?
You know a good company by speaking to them. If they're able to answer your questions directly, if you feel that they're giving information above and beyond and they're not trying to skirt issues or hide things or dance around your questions, that's a good indication. First off, they should be licensed. And in Florida, companies are licensed by AHCA, AHCA. And it's the Agency for Home Care Administration. You should also look at their website and see what they work with, how they present themselves, and how they're available to you, I would say. Are they available after hours? Do they make themselves available through email or through texting or through, you know, telephone conversations? But basically, they should be able to answer your questions in a straightforward manner. And you should get the sense that they know what they're talking about and that they're committed to home care, that they're committed to helping people when they need help. And that means the person locally and the whole family, because usually when something happens to a parent or a loved one, it becomes a family situation.
Okay, well, what makes Paradise a good company? What differentiates Paradise Home Healthcare from most other companies?
That's actually easy to answer. Besides our outstanding logo, which I think is the best in the business, what differentiates
it is a nice logo, I have to admit it.
It's very inviting. What differentiates us mainly are three things. Most companies will have nurses if needed, and then they have the caregivers, either a home health aide or a certified nurse assistant. We have all of that, and we have a social worker. I'm a MSW, which is Master of Social Work. So my training is to look at the bigger picture, to obviously help now in the present, but to put together a plan for now and a little bit into the future. Because when you're working with seniors or, you know, much older adults in their late 80s and 90s, a lot of things can start being anticipated. If somebody has a degenerative disease like a Parkinson's disease or COPD, those kind of things, there's a time frame, there's things that you know, and there's things that you can plan for. So having a social worker that'll look at a bigger picture, that'll know government benefits, that'll know community resources. It's really important to know what's within 5 miles of your house that can help you. Or if you need to plan for home care beyond in the home, whether it's in assisted living or nursing home care, we can help with that. If we can't, we refer to other local elder care professionals. So that's one thing. The second thing is that we have just a 2-hour minimum. Most companies in this area have either a 4-hour minimum or at least 3 times a week, something like that. We realize that it's really hard to have someone come into your house, especially if they're helping you with personal care. It's a very big change. It's the second punch of what's the presenting problem that leads you to call a home care company. So we realize that with a 2-hour minimum, a family can get started and they can try it out. And a lot can be done in 2 hours twice a week. We can help obviously with personal care like bathing and dressing, medication reminders, do a load of laundry, get to the grocery store, to Publix, which is our local grocery store down here. And, we can help do a breakfast, we can help do a lunch. So a lot can be done in 2 hours, and it's a way for somebody to get started. If you really don't need 4 hours, then you really don't want to pay for 4 hours, and you don't want somebody there for 4 hours. And the third thing is we don't use an answering service. You call on weekends or in the evening or on holidays, and you reach directly to Linda Lamont, who's the owner of the company, or to Lauren Hiley, who is our chief staffer. So we are very user-friendly. We realize that when people are dealing with illness or a medical crisis or an accident, a home, a fall, they need answers quickly, and they don't want to have to wait for an answering service to first contact us and all of that. So when we put it all together, we really try to meet the person's need at the moment. And then when we, stem the bleeding, as they say, when we do the triage, then we can look at, bigger picture planning. So those are the 3 things. Besides, we have a warm staff. We also are very careful when we interview caregivers. If we can't understand them on the phone, we don't invite them in for an interview. We also, pay weekly, which is a big deal. Most of the other companies in this area pay every 2 weeks, and that makes a big difference to the caregiver. So, we have a dual audience. We have dual parties to please. We have the families and the people we're working with, but also the people that are working with us. So, it's a good balancing act to try to keep everyone happy.
I can see that. Let me ask you this. Does Paradise Home Healthcare have a specialty?
We're very aligned with the National Parkinson's Foundation in Palm Beach County.
I know you do a lot of work.
Right. We volunteer with them, and I lead a couple of support groups at the Boca Y and at the Boynton Beach YMCA. We're very knowledgeable about Parkinson's, which is more of a physical problem than the cognitive, except, in later stages. We also have a specialty for Alzheimer and dementia because it's affecting so many people. That's a really big reason why people call for home care. The primary care partner, usually the spouse or an adult son and daughter, they get worn out. And no one can be a primary care partner ongoing without help. They collapse. So we are very knowledgeable about Alzheimer's dementia, Parkinson's, COPD. A lot of people obviously get home care for a hip replacement or surgery, knee replacement. That's usually short term. We are either help family for a few weeks following a surgery, rehab stay, or we're in there for the long term, which could be several years if it's a degenerative disease. A lot of patients, come to us with multiple medical pictures. Besides a big disease like Alzheimer's or Parkinson's or COPD, a lot of people have heart disease, a lot of people have diabetes, and all of these things blended together along with the aging process usually lead to requiring a little help. And a little help goes a long way in home care. If you can get somebody started in the morning, they're usually good for the rest of the day. In other cases, people need, standby assistance or someone present, for many hours or around the clock. We do hourly, we do 24-hour care, we do live-in care.
Very good. Well, Sherry, how can a potential client or anyone interested in learning more get in touch with you?
Well, they can either call 561-672-7170, and that's our office. They can call me directly on my cell, which is 561-376-6225. They can access by phone or by the website.
Okay.
Or you can obviously send an email to Sherry, Sherry, at paradisehomehealthcare.com, or to Linda at paradisehomehealthcare.com.
And I actually want to do this again and ask you some more really specific information, but this should tell our audience a great deal about Paradise Home Healthcare.
Right.
Very good. Very good. Well, Sherry, thank you very much. And I can't wait to see this, what we got here.
Yeah, it's fun hanging out with you, Jeff.
Same here. And listen, home care is a really important industry. People need help. And,
people need help.
And you serve a great purpose. So I'm glad to have done this interview with you today.
Well, thank you. It's very gratifying to know that I can help people through my knowledge, through my experience, and with wonderful caregivers. We match up people with angels.
Very good. Well put. Well, I'll speak to you again soon.
Okay. Thank you.
Thank you.